Good news, in fact great news for anyone who's interested in reducing their risk of having a stroke, and hopefully that's most of us. Robust clinical research published in a journal of the American Academy of Neurology confirms the link that having certain components in your diet can reduce your risk of having either of the two main types of stroke. In simple terms, a clot on the brain or a bleed on the brain. It suggests an up to 25% risk reduction of having a stroke. I love research like this because these benefits are achieved not from a fancy new drug, but from things you can just eat. How amazing is that? So what do you need to keep including in your diet to make sure you get all of these benefits? Well, it's all coming up. If you're interested in topics like aging better, in skincare and wellness, you just found yourself a new channel. I'm Dr. Andy Bouchan, a cosmetic doctor and GP, and this is a little bit of Bouch Talks. Okay, I suppose stroke is a bit of a heavy topic, especially for a Sunday, if that's when you're watching this. So for the next 60 seconds, come with me and my wife as we travel to central London for an overnight stay during winter. And see the description for more details on any of the places we visited and what we enjoyed there. Stroke is a devastating condition with a huge global impact. There are around 15 million strokes around the world each year, with as many as 5 million people dying from the condition and around 5 million suffering permanent disability of some sort. The newly published research would suggest that the Mediterranean diet can reduce the rate at which people have strokes by up to 25%, and this includes both of the main types of stroke, both ischemic strokes and hemorrhagic strokes. This is huge. And of course, this is in addition to all of the other benefits that you can get for protecting the heart, reducing the risk of myocardial infarctions by improving your cholesterol profile and also reducing the rate of getting type 2 diabetes. So, do you need to go out there and buy a new cookbook on the Mediterranean diet and learn the best recipes from the Puglia and Florence regions? The answer is no. You just need to include 5 main components in your diet with a little bit of focus on a couple of things to keep minimal. So those 5 main components are olive oil, nuts and seeds, seafood, whole grains and vegetables. If you can get those 5 things in, you're doing pretty well. But you will also need to be moderate with the amount of alcohol consumption you have, and you'll also need to reduce red meat. But if you can do those, you'll be in line to reproduce some of the findings of the study and keep the risk of having a stroke as low as possible. A diet like this would also be expected to keep levels of inflammation low in your body. If you haven't previously watched my video about inflammaging, be sure to go and give that a watch. And if you haven't yet done your biological age test, one such as the glycan age test, then now might be the time to go and look into that. Okay, that's all. It was just a quick update for you. I hope you found something useful in there. And if you did, please remember to like the video. And I'll catch you next time for a little bit more of a little bit of Bouch Talks.